Fragile X syndrome is a genetic condition that causes a range of developmental problems, including learning disabilities and cognitive impairment. Usually, males are more severely affected by this disorder than females. It is the second most common cause of mental retardation after Down syndrome, but most common inherited form of mental retardation. Males and females with Fragile X syndrome may have anxiety and hyperactive behavior such as fidgeting or impulsive actions. They may also have attention deficit disorder, which includes an impaired ability to maintain attention and difficulty focusing on specific tasks. About 1/3 of males with Fragile X syndrome also have features of autism spectrum disorders that affect communication and social interaction. Seizures occur in about 15% of males and about 5% of females with Fragile X syndrome. Many males with Fragile X syndrome have characteristic facial features that become more apparent with age. These features include a long and narrow face, large ears, a prominent jaw and forehead, unusually flexible fingers, and enlarged testicles, macroorchidism, after puberty. Mutations in the FMR1 gene cause Fragile X syndrome. The FMR1 gene provides instructions for making a protein called Fragile X mental retardation 1 protein, whose function is not fully understood. This protein likely plays a role in the development of synapses, which are specialized connections between nerve cells. Synapses are critical for relaying nerve impulses. Nearly all cases of Fragile X syndrome are caused by a mutation in which a DNA segment known as the CGG triplet repeat is expanded within the FMR1 gene. Normally, this DNA segment is repeated from 5 to about 40 times. In people with Fragile X syndrome, however, the CGG segment is repeated more than 200 times. The abnormally expanded CGG segment turns off or silences the FMR1 gene, which prevents the gene from producing Fragile X mental retardation 1 protein. Loss or a shortage of this protein disrupts nervous system functions and leads to the signs and symptoms of Fragile X syndrome. Males and females with 55 to 200 repeats of the CGG segment are said to have an FMR1 gene pre-mutation. Most people with a pre-mutation are intellectually normal. In some cases, however, individuals with a pre-mutation have lower than normal amounts of the Fragile X mental retardation 1 protein. As a result, they may have mild versions of the physical features seen in Fragile X syndrome, such as prominent ears, and may experience emotional problems such as anxiety or depression. Some children with a pre-mutation may have learning disabilities or autistic-like behavior. About 20% of women with a pre-mutation have a condition called Fragile X-associated primary ovarian insufficiency. These women may have irregular menstrual cycles, an inability to have children, early menopause, and elevated levels of a hormone known as follicular stimulating hormone. Men and some women with a pre-mutation have an increased risk of developing a disorder known as Fragile X-associated tremor ataxia syndrome. This disorder is characterized by progressive problems with movement, tremor, memory loss, loss of sensation in the lower extremities, and mental and behavioral changes. Chromosomal disorders usually involve loss of a chromosome or a piece of a chromosome, gaining a chromosome, or gaining a piece of a chromosome that has attached to another. These problems can occur during meiosis in both men or women, but usually in women. It is believed that most chromosomal disorders result in early gestational abortions, with estimates in the literature speculating that as many as 75% of all pregnancies are lost early in embryonic development. Many chromosomal disorders present with congenital malformation and mental deficiencies. I will highlight just a few on the next few slides. Down syndrome results from trisomy 21, which means each cell in the body has 3 copies of chromosome 21 instead of the usual 2. Less commonly, Down syndrome occurs when part of chromosome 21 becomes attached or translocated to another chromosome during the formation of reproductive cells like eggs and sperm in a parent or very early in fetal development. Affected people have 2 normal copies of chromosome 21 plus extra material from chromosome 21 attached to another chromosome resulting in 3 copies of genetic material from chromosome 21. Affected individuals with this genetic change are said to have translocation Down syndrome. A very small percentage of people with Down syndrome have an extra copy of chromosome 21 in only some of the body's cells. In these people, the condition is called mosaic Down syndrome. Researchers believe that having extra copies of genes on chromosome 21 disrupts the course of normal development, causing the characteristic features of Down syndrome and the increased risk of health problems associated with this condition. Down syndrome is a chromosomal condition that is associated with intellectual disability, a characteristic facial appearance, and weak muscle tone or hypotonia in infancy. All affected individuals experience cognitive delays, but the intellectual disability is usually mild to moderate. People with Down syndrome may have a variety of birth defects. About half of all affected children are born with a heart defect. Individuals with Down syndrome have an increased risk of developing several medical conditions. These include gastroesophageal reflux, which is a backflow of acidic stomach contents into the esophagus, and celiac disease, which is an intolerance of a wheat protein called gluten. About 15% of people with Down syndrome have hypothyroidism. Individuals with Down syndrome also have an increased risk of hearing and vision problems. Delayed development and behavioral problems are often reported in children with Down syndrome. Affected individuals' speech and language develop later and more slowly than in children without Down syndrome, and affected individuals' speech may be more difficult to understand due to an enlarged tongue. Behavioral issues can include attention problems, obsessive-compulsive behavior, and stubbornness or tantrums. A small percentage of people with Down syndrome are also diagnosed with developmental conditions called autism spectrum disorders, which affect communication and social interaction. People with Down syndrome often experience a gradual decline in thinking ability as they age, usually starting around age 50. Down syndrome is also associated with an increased risk of developing Alzheimer's disease, a brain disorder that results in a gradual loss of memory, judgment, and ability to function. Approximately half of adults with Down syndrome develop Alzheimer's disease due to having an extra copy of the gene that makes amyloid beta precursor protein gene, or APP. Although Alzheimer's disease is usually a disorder that occurs in older adults, people with Down syndrome usually develop this condition in their 50s or 60s. Turner syndrome is a chromosomal condition that affects development in females. The most common feature of Turner syndrome is short stature, which becomes evident by about age 5. An early loss of ovarian function is also very common. The ovaries develop normally at first, but oocytes usually die prematurely, and most ovarian tissue degenerates before birth. Many affected girls do not undergo puberty unless they receive hormone therapy, and most are unable to conceive. A small percentage of females with Turner syndrome retain normal ovarian function through young adulthood. About 30% of females with Turner syndrome have extra folds of skin on the neck, which is webbed neck, a low hairline at the back of the neck, edema of the hands and feet, skeletal abnormalities, or kidney problems. 1/3 to 1/2 of individuals with Turner syndrome are born with a heart defect, such as narrowing of the aorta, coarctation of the aorta, or abnormalities of the aortic valve. Complications associated with these heart defects can be life-threatening. Most girls and women with Turner syndrome have normal intelligence. Klinefelter syndrome is a chromosomal condition resulting from having 47 chromosomes, in which the male has an extra X chromosome, and that affects male sexual development. Males with this condition typically have small testes that do not produce enough testosterone, which is the hormone that directs male sexual development before birth and during puberty. A shortage of testosterone during puberty can lead to breast enlargement, gynecomastia, reduced facial and body hair, and infertility. Older children and adults with Klinefelter syndrome tend to be taller than other males their age. Compared with other men, adult males with Klinefelter syndrome have an increased risk of developing breast cancer and chronic inflammatory disease called systemic lupus erythematosus. Their chance of developing these disorders is similar to that of normal adult females. Boys with Klinefelter syndrome may have learning disabilities and difficulty with speech and language development. They tend to be quiet, sensitive, and unassertive, but personality characteristics vary among males with this condition. Triple X syndrome, also called trisomy X or 47XXX, is characterized by the presence of an additional X chromosome in each of a female's cells. Although females with this condition may be taller than average, this chromosomal change typically causes no unusual physical features. Most females with triple X syndrome have normal sexual development and are able to conceive children. 47XYY syndrome is characterized by an extra copy of the Y chromosome in each of a male's cells. Although males with this condition may be taller than average, this chromosomal change typically causes no unusual physical features. Most males with 47XYY syndrome have normal sexual development and are able to father children. 47XYY syndrome, also known as Jacob's syndrome, is associated with an increased risk of learning disabilities and delayed development of speech and language skills. Delayed development of motor skills, such as sitting and walking, weak muscle tone, hypotonia, hand tremors, or other involuntary movements, and behavioral and emotional difficulties are also possible. These characteristics vary widely among affected boys and men. This concludes our lecture.